Thank you, Herman. To other news now. More concerns this evening about a new COVID-19 variant sweeping through China and its potential impact on Jamaica. Shamela Pullen has more in this primetime news follow-up.
There are currently 5 subvariants of the highly transmissible coronavirus Omicron variant. The Center for Disease Control lists them as BQ.1.1, BQ.1, BA.5, BF.7, and XBB.1.4. The CDC estimates that in the week ended December 24, XBB accounted for 18.3% of the COVID-19 cases in the United States, up from 11.2% in the previous week. In China, where there's also a surge, there are fresh concerns about new mutations.
The variant in China is called BA.7. It's a subvariant of BA.5. It is just as mild as the original variant, but the fear we have is that if it spreads throughout the Chinese population, that it could mutate to become more aggressive. Therefore, we have to keep our eyes close on what's happening in China.
Public health specialist Dr. Alverston Bailey is, however, confident that based on past experiences, the country should be able to contain the spread if the subvariants reach our shores. The Minister of Health has already indicated it remains on high alert. Still, with roughly 20% of the population vaccinated against COVID, there is cause for concern. This given the increase in visitor arrivals and the numerous events taking place across the country.
I do think we will see an increase over the next couple of weeks because of the complete lack of restrictions that is now taking place. And I sense that many of the populace seems to have entertained the thought that the pandemic is over.
Between December 20 to the 23rd, the Minister of Health confirmed 33 new COVID cases, bringing to 152,791 the total number of Jamaicans who have been infected by the virus. Kingston and St. Andrew continue to see the highest numbers with 12, followed by St. Catherine with 8 and St. Anne with 5. But Dr. Bailey is of the view that while widespread testing for the virus has stopped, the ministry needs to do more targeted testing,
which is to test those who come down with severe acute respiratory infection so that we can get a feel as to the positivity rate. The criteria the ministry has used over the years has proven to be quite accurate in telling us the positivity rate. And I think if the same approach is used going forward, we will get a good feel as to what's happening. And once the positivity rate rises above 5, then it means that it's time again for us to review our approach to COVID management and perhaps to be more vigorous in recommending restrictions.
Shamela Pullen, TVJ News.